So first of all, let me welcome all of you for the publishing of the first telemedicine registry that we have prepared for the solutions which are available in India. Now, we have actually been at this exercise for the last 4 or 5 months, and I must give you a brief history of why it was started and how it was started. When COVID struck and lockdown was announced in March, there was a big problem for the doctors as well as the patients. We could not go to the hospitals. The patients and doctors had to suddenly disrupt the care, and that resulted in a lot of sudden unforeseen issues of following up on your patients or for the new patients to come and visit the hospitals. Even when the lockdown was relaxed, the social distancing norms prevented people from getting out of the house, and therefore attendance at public places was minimal. So hospital being a public place, patients were scared to come there even though they were sick. So all this, all of a sudden, it necessitated an innovation or use of some method of communication between doctors and patients. And telemedicine, which has been there in the country for the last 20 odd years, suddenly came to the rescue. Everyone who was shy to use telemedicine earlier realized that this was the way forward. In addition, to facilitate the telemedicine consultation, the government came up with telemedicine practice guidelines, which legalized the telemedicine consultation activity. It gave the legal sanctity to charging for a telemedicine consultation. Having said this, the stage was set for doing telemedicine consultations. There were a lot of solutions in the market, and there were many willing users, the doctors and the patients alike. But what was not clear to the doctors and the healthcare providers, the organizations, is what telemedicine solution, what is it that they should use? What is it that they should look for when they are trying to select a telemedicine solution, which is appropriate to their needs, their organizations, and the kind of practice that they are doing, and in the region that they are practicing. When this problem came up, Dr. Agrawal from CAHO, which is the organization of the accredited healthcare organizations in the country, we had a discussion with him, and we brainstormed along with some other alliance partners, which is CHIME, HIMSS, and we were supported ably by NRCES to come up with a solution for this, as to where is it that the healthcare provider should look for a telemedicine solution which is appropriate to their needs. This registry was born out of that deliberation, the discussions, and therefore we felt that the users need to have one place where they can go to and identify what they're looking for. This is the reason why we felt that the registry should be done, and we've been at this exercise for the last 5 months. What it is additionally expected to give is an information to the vendors, the entrepreneurs, the innovators who are trying to make telemedicine solutions or trying to add features to telemedicine solutions, because they will at one place understand what is the needs or the demands of the market. And with this, I want to actually now call on our alliance partners to share with you what are their views on the registry. So is Dr. Agrawal here? Jay, can you unmute yourself and introduce yourself and give your views on the registry as how we came about?
Yeah. Thanks, Dr. Uma. I think it's a great introduction, and thanks everyone for joining the call today. I think if you really look at telemedicine, it's there in the country for a long time, right? But then there has been, always been a challenge in terms of clarity around regulation. What is the best practices? So the Ministry of Health has released telemedicine practice guidelines. Since then, there has been significant increase in the adoption. Now, if you look at India as a country, I mean, we are a startup nation, right? We have like thousands of startups and coming up with various solutions around different use cases for telehealth. But in the provider context, there isn't any registry where they can go and look at different vendors, what product features and capabilities, how do we really even compare and benchmark? So these are some of the fundamental challenges that we really had. I think I really want to thank DH India for taking a lead on this and kind of really bringing all of us together in a single forum to really contribute. I think over the last 6 months, there has been a lot of work has gone in to really look at individual vendors, look at what are the pros and cons, and kind of a SWOT analysis, looking at various facets of features and functionalities, and really coming up with a very comprehensive set of registry. So I really hope that providers at large in India will benefit, and it's not going to be like a static registry. We will continue to kind of incorporate and make it really live system wherein you can really rely on in terms of for your own decision making and really take it forward. So with that short introduction, I'll hand over back to Dr. Uma. Thanks everyone for joining today.
Thank you, Jay. Thank you for your support and guidance at all times. Dr. Vijay Agrawal, can I please invite you?
Yeah, thank you, Dr. Uma, and good evening, friends. I bring you greetings from the Consortium of Accredited Healthcare Organizations, and we are very proud to be a part of this alliance, which has come out with this very, very important report. I would say the second most important document after the publication of the guidelines. We represent the providers, and therefore what we can try to say is that telemedicine had always been a very important part had to play an important part in the delivery of healthcare. But somehow it had been dragging not only feet. In fact, a lot of doctors were in fact of the opinion that it is not even legal, because there were very, very, I would say, unfavorable judgments and observations, including one of the medical councils and one of the high courts. So when this pandemic started, CAHO had also approached the court to urge them to release the guidelines. We don't know to what extent whether that filing of the court anything did. Already, I think a lot of work was being done by the Telemedicine Society of India, and ultimately the guidelines were published, which were at least a very welcome step, I will say, towards the implementation of telemedicine in this country. But once that happened, then you could see mushrooming of people coming to the providers and saying that to use this platform or that platform, and right from a very generic thing like WhatsApp. So I think it was extremely important that we had a kind of a comprehensive registry of the various platforms being available. And not only that those platforms are available, there should be some method by which a doctor or a healthcare provider can try to differentiate between one and the other thing. And that's exactly the kind of work, I think, exemplary work under the leadership of Madam Dr. Uma, as well as DH India and CAHO, CHIMS and HIMS, Time and HIMS have done. This alliance has done a great job. I really congratulate all the people who have put in, I would say, extreme amount of hard work in bringing out this report. And as has been said earlier, this is going to be an ongoing activity. And I once again, Madam, compliment you, congratulate all the people concerned. And we are eager to listen to your report. Thank you.
Thank you so much, Dr. Agarwal, for introducing the topic as well as your support at all times, because it is the feedback from the user community that this registry is based on, and that is what we are here to serve. I would like to invite Manisha from NRCS. Manisha, would you please unmute yourself? Yes.
Yes. Thank you, Dr. Uma. So yes, this initiative was an essential initiative, since we know that telemedicine is an essential tool for remote medical and specialty care, and it was very important to look at all the different use cases, such as doctor to patient, provider, doctor to specialty, and also to look at the other aspect of usage of telemedicine, and give the all the user community a platform on providing a set of telemedicine solutions and the features provided by them. So NRCES, National Resource Center for EHR Standards, is set up by Ministry of Health and Family Welfare, which is responsible for accelerating and promoting adoption of EHR standards in India for all the healthcare IT applications. This exercise was essentially supported by NRCS to promote incorporation of health IT standards in telemedicine application, as well as to create a ready list of these applications for users and providers to know the whole gamut of applications which are available and the services which are there for use. So this exercise is also aims to, from the NRCS side, it aims to encourage all the application developers and telemedicine service providers to adopt and use standards as notified by Ministry of Health and Family Welfare, and play a pivotal role in national digital health ecosystem building. It's a very brilliant initiative by DH India and a collaborative effort by all organizations, including CAHO, HIMSS India, Chime India. Thank you, Madam.
So we've already discussed about how it started. Can you go to the next slide, please, Gaurav? So we have also discussed as to why we started this. So when we decided to invite applications in the month of March, April is when we thought about it, and we started this. We have since then 200 applicants. And in those 200 applicants, what we did was, initially we did a pilot study of 30 applicants, the first 30 that we got, and we thought that came closest to providing telemedicine solution. And we have actually on our website, telemedregistry.in, also published that interim report that we had done after evaluating the 30 solutions. We got to study a lot of them, and we also learned a lot of how to evaluate and how do we understand as to what the user wants from them. And after fine-tuning our evaluation methodology, after studying those 30 solutions, we then re-evaluated all the solutions that came closest. Now, from the 200 products that had applied to us, the 109 came closest to what we were evaluating for our need. And what was the immediate need? It was to actually evaluate the products that can help us do a virtual OPD, which can just facilitate a direct doctor-patient consultation. So for that, we found from the primary response 109 solutions that fitted that description. The other descriptions were for the other products that have applied to us is for tele-ICU, remote patient monitoring, and specialized telemedicine solutions like telepathology, tele-ophthalmology, then certain disease-specific or certain specialty-specific solutions, which will be evaluated from next month on, and we will be adding them to the registry as well. But we did not want to delay publication of this registry any further. Therefore, although out of 109, only 72 have been totally evaluated, some of them are pending validation from the companies. See, what we do not want to do is misrepresent any company's information. And therefore, we do go back to the companies and validate what we have assessed and what they have shown in their product. Sometimes we check it again. And most of the applicants who have undergone the process of evaluation know that we want to represent them fairly and make sure that it is the correct information about them which is available in the public domain. Now, many of the people, they wanted to know why we do not sign an NDA with the product companies. That is because we are only evaluating a product based on information which they do not mind making available to the public domain. And therefore, we do not sign any NDA with any applicant. Can we have the next slide? Gaurav, next slide. It's stuck. So we have tried to see the usability of the telemedicine solutions in the rural landscape as well as in the urban landscape. So if you really see the brick and mortar structure of the rural landscape, it really starts with an ASHA worker, goes to the PHCs and the CHC and the medical colleges and the larger hospital. Whereas in the private healthcare sector, it starts with an individual clinic, a practitioner's clinic. There would be nursing homes, there would be larger clinics, there would be hospitals, individual hospitals, and enterprise class hospitals, larger ecosystems with multiple larger and smaller hospitals. So we have assessed the suitability of these solutions in all these scenarios and seen whether what an individual solution is capable to cater to. The idea was that if there is a solution that is being looked upon by an individual practitioner, there are minimal features that an individual practitioner needs for his clinic. Whereas if we are looking for an enterprise class solution, which is for a large hospital or for a group of hospitals, then you're looking at a different solution with a different capability. So we have tried to look at all these features. We've also looked at features related to data security. Some of the things that we have kept in mind is that, like, we know that some of our applicants could not come for evaluation because they were in COVID containment areas. So out of the 40 odd people that still need to be completely evaluated, some of them, at least 6 of them, could not actually attend the evaluation process because they were in containment area. 2 or 3 of them had emergency to attend in the hospitals where they were working. Therefore, we have seen all those situations and we have kept in mind all those situations while we are evaluating. We have also taken a note of the compliance with telemedicine guidelines. Now, the telemedicine practice guidelines, if you ask us, is literally a watershed moment in the history of not only telemedicine, but also the entire digital health landscape. It is only next to the document of National Digital Health Mission, which was announced by the Prime Minister on the 15th of August. So if National Digital Health Mission has to fulfill its promise and has to be realistic, then we must know that telemedicine plays the same role in the digital health ecosystem as an ASHA worker plays in the brick and mortar conventionally existing healthcare ecosystem. The point of contact with the patient, and that is what is most important. And NDHM proclaims that the journey will be towards a patient's health record, where the patients will have control over the data. So if we are going to dream of a PHR, we cannot have it before giving telemedicine the right place in the digital health ecosystem. And therefore, it becomes all the more important that the solutions that we make cater to that futuristic need. And although we may all have our limitations, despite the fact that we have, some of the best organizations have come together, and this is the first such exercise. So before we go forward and we bring to you the results of the registry or the findings that we had in the report, I want to apologize to all the applicants, just in case there has been an error on our part. And for that, when we publish the registry, we are open to making corrections and you coming back to us if you find that something has been not understood by us properly while you were explaining. Because at the end of the day, we are all human beings and we all have our limitations. Now, I'm going to invite Gaurav to go through the rest of the report. Gaurav, it's over.
Thank you, Dr. Oma. Thank you, Dr. Oma. So here I present you the India's first telemedicine registry that we are talking about till now. So as Dr. Oma and other leaders from the Alliance partners said that what is the first thing that we focus is the full amount of knowledge for the selection of a need-based solution. I want to just add another line to it. Along with it, selecting a need-based solution, the other part is implementation. So that's what we focus on the entire telemedicine registry, from a selecting to a need-based solution to its implementation and looking at all the corners of the healthcare ecosystem, whether the doctor, patient, and also that the participants that are present here as the telemedicine vendors. So you're looking at the use case. So what the first thing that comes in the mind about talking the word teleconsultation? So what is the first thing that comes in our mind when we talk about the teleconsultation is the virtual OPD, and there is bond that is maintained between the doctor and the patient. Bond is an interaction, which can be in the form of audio, video, or a chat. Also, at the same time, there is a kind of communication exchange done between the parties. Then the communication exchange can be from the patient to the doctor and the doctor to the patient when we talk about the consent, prescription, or the records, past records that the patient wants to show to the doctor. So this use case shows about the basic stage also to a intermediate stage where where the telemedicine talks about the patient and also the attributes of the patient, whether it is urban, what are the features for the caregiver, or whether it's a patient is from a rural area. Also, at the same time, talking about doctors, the attributes of the doctor, that we focus on whether the doctor is an individual clinic or an enterprise hospital. Also, how a device integration can make a teleconsultation to a remote patient also. So similarly, here comes the advanced use case where it is not just the patient in outside, also in the inside of the hospital, which is technically known as the telemedicine. And also, when we talk about the use cases, you have seen here that we focus on.
Ayushi, can you take over from here?
Yeah, thank you, Dr. Uma, and thank you, Gaurav. So I think we have heard some of the basics of the use cases. So these were the use cases which were part of the ethos of the whole of the alliance member when we were discussing about the teleconsultation solution and how we thought about evaluating the teleconsultation solutions. Uh, so let's start with how we had gone about thinking of the teleconsultation solutions and on the spectrum of the complexities in terms of what needs these solutions are expected to fulfill. The solution starts from a very basic connectivity, which is door to door, a kind of a replacement of a virtual OPD, moving towards advanced continued care solution where data is integrated from the patient record are not just one-time care record, but there's a continued care which is possible and there's data integration facility available. And the other end of the spectrum is the population analytics. That is when we have the data from the teleconsultation solution. How do we go about using that data for the analytics purpose? So a provider should facilitate door-to-door connection, and at the advanced level, at the top of the spectrum, we are thinking of a solution which facilitate the population level analytics also. And at present, since we are in COVID times, we have been facing issues like tuberculosis issue, and then there were a lot of research going about the other conditions. There's ongoing research about diabetes, there's ongoing research about thrombosis in patient. There are many other epidemics like malaria and dengue. So community intervention, population analytics came to play a role there. And when we are talking about replacing the face-to-face consultation, at least have an alternative to that in terms of the virtual consultation via telemedicine platform. The record should not be broken. And that is the final vision which solution providers or which we as an ecosystem thought ideas had uh, for the pathway which we thought about for this telemedicine registry. Dr. Ma, next slide. So going to the process, we have heard Dr. Uma that she has mentioned that we have been empathetic toward the people who were not able to make it to the demonstration. But what was this overall evaluation about? We started with the registration portal where firms registered who had teleconsultation solution, and it was started with not just telemedicine. We had four different tele providers, the tele ICU, the remote healthcare, and teleconsultations being one of those. And after that, our team went on and did the secondary research on all of these products. So there's a lot of information which is available on the website. We have products which are available via app store like Android app stores or the iOS system or the website related details which are available. So the team has done a secondary research, and from that, based on the primary responses, the companies were shortlisted. Those shortlisted companies were invited to fill out the pre-evaluation form. Now, this pre-evaluation form helped us to prepare the summary of the company. May I request someone to mute?
Yeah, people who are not speaking, please mute themselves.
Thank you so much. So I was talking about the evaluation exercise, and we shortlisted the companies based on the secondary research and the primary responses. And from there, we move on to inviting the companies. The inviting the company means getting more details from them. So we send out a pre-evaluation form to them, and that evaluation form aided the expert panels. The information from the secondary research and the detail gathered via pre-evaluation form, which companies have themselves provided, was available to the expert vendors at the time of the evaluation. There's a lot of detail about how we have selected the expert evaluation, how we ensured the anonymity of the expert evaluation panel, how we ensured that expert evaluator panels do not have the decay in their evaluation, because when we evaluate some product, immediately we have a better idea about what they are trying to provide us, but after a time we forget, we lose out on information. So after every evaluation, the evaluation form was filled, which was uh, enabled or in terms assisted by the another member which was not part of the expert panel to ensure more objectivity in that process. So these details are again available on our website in terms of methodology document. And while going through this evaluation exercise, finally what we have done, we have inductively arrived at a maturity model, which we'll see later. And based upon this, we'll be mapping the solutions at which level of maturity they are. We are working on a summary, which Dr. Uma has mentioned that we'll be releasing on the registry, which will aid the organizations, which will aid all the stakeholders of the healthcare system, which we expect would be involved in the teleconsultation, whether they are organizations, the clinicians, doctor, frontline workers, or the patient themselves, not just the patient, their caregivers also. So that is the final goal, to release a summary on our website about the companies which were evaluated. The evaluation summary was curated based on the expert feedback and the evaluation exercise and the pre-evaluation forms. It will be shared and people can come back, and we'll be more than happy to make any corrections. So this is the overall process which we are following till now. Next slide. Dr. Ma, are we at the next slide? Because in my screen it is showing the same slide methodology.
It's the same slide. Yeah. Now it's the next slide. Yeah.
Thank you so much. So this is the maturity model. So let's get into what is this which we are talking about. What you see on the screen is a maturity model framework developed inductively as part of this evaluation exercise. The model is stratified into 6 levels, and each level denote increasing order of the product usage, increased consideration of stakeholders' needs, that is taking into account ecosystem of stakeholder, which includes all the stakeholders which we considered as part of the practice. This framework, as I'm repeating again, is derived inductively based on categorization of features, attributes of products, evaluated as part of alliance effort, and also by going through the previous research and policy documents, along with the drafts that are available in the public domain or are under consideration by the Indian government. This model then caters to our needs, the need of Indian teleconsultation ecosystem. Before I start elaborating on the model in details, this model will be released in 2 weeks, and then also it will be a living model. That is, as regulation, technology ecosystem, and healthcare needs of doctor and patient will be evolving, so will this model. So that is something all the alliance partners and Dr. Maha mentioned repeatedly, that we need to put out something which is living. It will be our ongoing effort. Now we started with the consideration of teleconsultation solution as comprising of information processing ecosystem, information technologies, and the regulatory systems, which are again rooted in the Indian context. And what we learned that the features that are part of platform offerings and are relevant for telehealthcare providers and telehealthcare consumers are features ensuring interaction and communication between provider and consumer, features to locate and validate the identity of the doctor and patient, and then in order to make this interaction reliable without breaking the trust which actually exists between doctor and patient, rather mediating and facilitating that trust, platform should have attributes that ensure all of these features. So these are the basic features which we considered distributed across the level, as you can see on the screen. These came out to be in some sense the mandatory features across each level. Besides this, some other elements are relevant for teleconsultation business that differentiates them from other, like creating or capturing the market or aspiring to be the market leader or meet the need of stakeholder which they think are the pain points which are existing and challenging. So we call these features as aspirational features, and in each level we have identified some aspirational features which feed into, some of them feed into the prime features in the next level, while some of them remain aspirational features across our distribution at present. So this is a structural layout of the model. Getting into the details, let us look at the column of interaction and communication. So platforms have basic capability of audio calling, voice calling, to advanced features where video calls are bandwidth optimized. And I think by now you must have idea that I am in the capital city of Uttar Pradesh. Still I'm facing the bandwidth issues. Same is with the Gaurav. So we need solutions which are in urban region also bandwidth optimized. This enables doctor to get physical sense of patient, glance, or give a medical gaze, which are required clinically to provide care. Then also doctor should be able to write prescriptions at their end and share with the patient by taking image. This is a level 3 solution you can see on the screen. Platform could facilitate doctor in writing prescriptions, taking notes, drawing images, explaining, and also have possibility of customization of prescription as per their needs when platform generated prescription is there. It is required to allow doctor to add their credentials, to put up their signature either in the signed format, digital signature, or e-signature in the end. This is the level 4 solution. Some attributes of level 4 solution. Advancement can be made by catering to patient across diverse geographies in India, by writing multilingual prescription for patient and easy to use rule-based suggestive data entry formats for doctors while writing prescription. So the overall objective of the healthcare is getting the records, and the overall objective of healthcare records and digitalization was that there should be availability of records for lifetime of the patient, so that patient can use whenever they require, and so is with the doctor, that they can use those records whenever they require, maybe for medical legal cases, maybe for research purpose or any other work. So data security is very important then, from basic secure transmission of patient data towards advanced state solution where data is stored securely in federated manner and anonymized. So once we have talked about this data storage and capturing facilities, we also need to inform the platform need to take permission from the people whose data they are generating and storing. The platform in sense means the users of the platform also, and the platform should facilitate that. This is consent. In the case of consent, we start from the basic platform conditions like terms and conditions of the platform for the platform usage, which most of us are aware. We just say we agree, to the advanced consent management where people are explained in their language the data usage, data storage, data access policies which are applicable across the platform users. We also talk about advanced consent embedded in the context of India, where we have guardian system of teenager, guardians of married women by their husband requiring multiple permission to access the healthcare. All these people who desire autonomy over the data, or any patient who is undergoing any treatment for stigmatized condition, their communication should be ensured in a secure manner, and then they also should be communicated and explain the data usage, data storage policies. So at the advanced level, we are expecting the platform to facilitate this at the 5th and the 6th level. So this is what we talk about, the mediating the the trust which exists in the physical world when we visit the doctor, translating that into this digital space. Besides this, we also have admin mode, payment, cancellation, refund processing. Then we start with doctor ID, verification of doctor, to the standard data capturing and transmission standards as we move towards the advanced stage. So by talking about all of these, you all can get a sense that we are moving towards from the basic platform capabilities, which are very much required, to the advanced level capabilities, where we have drug database integration, clinical diagnosis standards. So this is a broad overview. The important point or the critical point is coming now. In terms of compliance, this model is very easy to understand, and that is very critical part. TPG compliance. A document must read to understand, not just for doctor, but for the ordinary citizens. We all should be aware that what is there for them. So TPG compliance should be there if a solution has to be mapped to the level 3. So if solution is TPG compliant, they'll be mapped in the level 3. And if it's not compliant or partially compliant, they'll be in level 3A. At the level 6, we are hoping the solutions to be cognizant of other critical attributes in teleconsultation, which are coming from NDHM and the PDP bill, the relevant points for the teleconsultation domain. So this is the overview of the framework. Now let us move to get a glimpse of how teleconsultation ecosystem in the country is at present, the report which is there, what is happening. And based on the data which we have from the evaluation exercise, we present you these slides. So this is very interesting. The mobile penetration within India is reflected in our solution providers' choice of devices also. You can see on the screen. Mobile is the preferred mode of providing the solution. Large screen devices are required and are more valued for the doctor usage. They need to see patients, they need to do annotations, they need to write prescription. There's a multitasking which used to happen in the physical world. It should be facilitated via platforms. Interesting aspect is enthusiasm toward rural India and solution providers' vision for teleconsultation, which is at par with providers talking about urban people as a prime user, maybe prime consumers or prime customer. This is good and hopeful and need of the times. There are few innovative features in overall business process transformation that are facilitating this. Use of kiosks, setting up teleconsultation centers which are walk-in for patients and connect them to the remote doctors, training of frontline workers and designing a device and solution that enable them, enabling the community, the trust of community workers via their own solution. It was really encouraging for us to go through the expert panel report to see that tier 2, tier 3 cities are also part of the vision of the vendors who are launching their product, and they're expanding their solution not just from the urban region but to the peri-urban region, in fact equally well into the rural region. We asked the providers about what they value most, and this is in line with the previous solution. And the answer is very much embedded in the Indian information technology IT DNA. We are enthusiastic about reducing the cost, doing the jugaad or something. We are actually enthusiastic about reducing the cost, and that is the way to go about improving the clinical care delivery in India and improving about the healthcare outcomes. So there was a balance, which is again interesting to see that people are enthusiastic about reducing the cost. At the same time, they were thinking about the healthcare outcome. So this is based upon the question which we have asked in the pre-evaluation form. We asked the providers what they value most. We gave them few options, which were based on the research and our understanding of Indian ecosystem. And then they were asked to rank that. So in healthcare outcome, we expected that they were willing to reduce the mortality due to TB or at present because of COVID-19 by a proper triaging with the help of their teleconsultation system. So this is an interesting picture of what is valued by the providers, by most of you all who are present for the Indian ecosystem. So in terms of customer, we saw that a lot of providers are focused on primary care, but with the integration of advanced technologies like IoT, education context, which is available in the platform, or in general with technology savviness or awareness, which is increasing, we are expecting that specialty specific platform design would match up with the needs of the services of the people. Not just large hospital, individual doctors are willing to opt for teleconsultation along with face-to-face, and so are the providers working to facilitate them, which we see in this slide. We see that there are solutions which are for the the small independent clinicians to the large hospitals. We have solutions that aggregate doctors, healthcare organizations, and also provide the white labeling features, that is B2B model along with white labeling. It is important for branding. And in the present times when we live in the world where people are getting more and more conscious and they are demanding self-branding, the provision of white labeling is a good business move, which we have seen in our result. Our focus was on evaluating products in facilitation of the workflow of clinicians and also patients. So we started, so how do doctors start using platform? How do they interact? What all kind of interaction are possible for the clinicians? What all kind of interaction are possible for the patient in the platform, which we call as a workflow from the doctor and the patient side. And we saw that around 50% of solution have completeness of the workflow for doctor. This is relatively less, 40% for the patient, but this is important because many solutions were envisioning doctors as a prime user of their platform, and the patient also have started becoming a prime user or prime consumer of the platform in the product concept as conceptualized by the vendors which we have evaluated. We also thought about the platform which should be easy to use, and it should not be just easy, it should be simple and efficient in terms of workflow, and that is where we are moving. We have more than 30% of solutions that are rated by experts to have optimized workflow and intuitive EI, another enthusiastic thing for the Indian teleconsultation ecosystem. Panelists have also come across the platforms, and they used to mention to us that they are platforms which are easy to in onboarding. They are focusing on onboarding of the doctors. There's a training support which is available, the customer support which is available via call and video conferencing. So this is the aspect which tells us that it's not just about providing the solution, but about ensuring that the solution gets adopted. And that means reducing the effort expectancy in usage of platform for the doctors and for the patients both. In terms of guidelines, the ecosystem is again giving a positive signal. This is also because guidelines are basic at present. We see panelists mentioning that more than 50% of solutions are satisfactory or above average in terms of meeting the guidelines. The pain points were consent, signature, platform generated prescriptions, but still overall the picture is very enthusiastic. Data exchange standard is also showing us hopeful picture because this has been the global issue, the data integration, the exchange standard. But we realize that more than 30% of solution provider have started working, or they have actually integrated the standards in the platform. the standards being HL7, FHIR, ICD or snowbed integration, that is diagnostic standard also, and the data transmission or the data exchange standards also, along with the standards for the storage of the image like LOINC, DICOM standards. Although many solutions have claimed to have interoperability, it was not demonstrable because of because the clients have not requested that. So providers we came across were willing and were capable of providing the interoperability. So this is the kind of bird's eye view of interoperability over a range of telemedicine solution in India. This covers standard compliance again like HL7, FHIR. So as I've already elaborated that many solutions do claim that they have interoperability, and the demonstration sometimes became difficult because of the demand side constraints for them. So the another thing is that the solution providers are giving specialty specific template, and there are a lot of solutions who are not just focusing on the physician's consultation workflow, which is in terms of the provider language, the provision of subjective assessment, then some objective note taking, and then the prescription, and finally the diagnostic and other plans. They also provide the customization facility for the specialty specific, like looking at the vital in case of pediatric or the gynecology consultation, or providing the facility of having the private notes in terms of psychiatric counselors who need to use their system, or provision of having the X-ray which they can which anyone can annotate and use in terms of orthopedic or other type of consultation. In fact, many dentists are using teleconsultation solution. We come across the platforms who facilitate that also. Besides this, we have this the doctor stakeholder. There was a similar distribution of the patient as a stakeholder. So patient for us was not just the patient as an individual. The patient comes with the dependents, the caregivers, and again we came across the solutions who claim that at least they provide the facility for the dependent to take an appointment, and then the link is shared on someone else's mobile number so that people can join and do the teleconsultation. The another perspective important for patient was cancellation and refund. One another aspect which is important as the NDHM starts, it becomes a bill and act, or it becomes a proper guideline, like we have a TPG guideline, which is a control over the record. So patient control over their own record in terms of sharing the consent, and the patient control, the patient dependent control over the record. And there also we have seen a positive movement. The 30% solutions talking about is a very enthusiastic picture of the Indian ecosystem, that how much we are valuing the autonomy and the privacy aspect of the patient and their lives in terms of data usage, data gathering. Overall, when we talk about the Indian ecosystem is diverse, it's complicated or complex because of the various socio-cultural aspects which are there, which involves the people across the diverse geographical locations, which involves our variation in terms of the functional literacy rate of the people, and we came across solutions who facilitate such patient in doing the consultation using their platform by having features like voice typing, by having features for the circle of care or dependent, by providing synchronous multi-party communication. A child living in the US or Dubai could facilitate the consultation of the parent in any part of the country in India. We're talking about the urban middle income, but that's the vision. That is part of the social cultural fabric of the India, and this we come across solutions who via their features have thought about such patients and facilitate that. What we have not encountered is solution having dedicated features for differently able doctors and patient both, and we look forward to that. The next part is, so now we know what is the report. We will be releasing that report. Our website will have the videos from the alliance members. Will try to put up other curated contents, but the most important part is the registry detail, the evaluation, the evaluated profiles of the companies, and the overall summary. So it's important to know how we facilitate people to use the telemedicine registry. This is the page, and if you are an applicant, you can go to this application tab, and then a drop down menu will come. You can see the number of people who have applied. There will be option for you also to register and do the register for the evaluation. The next phase of evaluation, we initially said we are starting from the 1st November. It definitely in early November, we open the registration again for the future evaluations. There's a registry tab which gives detail of the evaluated companies. Then we have study where we talk about the methodology, and we also have the tab where our report would be released. And then the resource link to the glossary, the key items, how we interpret it, from where we are picking our meanings, whether those meanings are from MCI or from WHO. So the glossary of word which is available for people to understand, so that the communication is simpler, because uh, the doctor and patient education is also an important part of, or the part of vision of this alliance. So this is the broad overview of how you can use the registry. If you want to check the company profile, this is the current layout. And if there's any change in the layout, we'll definitely put it on social media. At present, you need to go to the registry, and then you need to click on the name of the company. And besides the company name, you'll get the product summary and the expert evaluation summary. Wait for a day or two, we'll put out the expert summaries, which are curated. They are under various type of check, including the grammatical check. And then again, we will be open for you to give us the feedback if you've gone wrong again. Please pardon us, apologize for that, and correct us, help us make the changes, and help us make the correct information available in the public domain.
Let me take over from here. Based on the evaluations that we have done so far, we will all agree that telemedicine solutions in our country have suddenly grown in leaps and bounds. I think it was required in the global interest, and largely the way we have done it, it is keeping in mind the national interest. I want to tell you that every single person that has worked on this registry has worked as a volunteer and has spent a lot of time in the last 6 months. And this has been just to tide over the national calamity that we are facing in today's date. Now, when we see this, the difference that we've seen, which has happened from the pilot phase to the final evaluation phase itself, was tremendous. The companies that we had evaluated 3 months ago, when they came back to us for the final evaluation, they had made significant changes, really, keeping in mind the exploding need in the country for the telemedicine solution to be adopted. Now, to all the applicants that, we want to say that please update your company's website. What the users look for is what you give in the website. More often than not, we find that the website is usually it is incomplete, it is sketchy, and there is a big difference between what we have taken as content from the website to evaluate a company when we write to them, vis-a-vis what we have seen when we finally evaluated and saw what they had to show. And many times, we have suggested to all of them to update the company's websites, put the video links, because that's very helpful for the users to see. We were in a space before March where there were no standards for telemedicine guidelines. Now for digital health, there are plenty of standards that are being brought into the country. So besides telemedicine guidelines, you have patient data protection bill, they have health data security and privacy policies, we have the NDHM. So there will be a significant growth in digital health in India. Digitization of healthcare promotes transparency, promotes access, promotes ethical medicine, and brings down the cost of care, which are very, very important. So there is no denying the fact that India and the Indian healthcare system is going digital. So for all of us who have not adopted digital technology, this is the time to adopt, and we have to start somewhere, and we have to start with telemedicine guidelines. But for the solution providers, make sure that you comply with the standards that are existing. Complies with the standards that are given in the EHR standards, the TPG guidelines, and all the guidelines that will come. Going forwards for health data security and privacy, we will also have to look at the guidelines from the Ministry of IT. So it is necessary that we are at all times aware of what is happening, not only in terms of guidelines being published by the Ministry of Health, but also by the IT Ministry. So it's very important. So data security and privacy, as I said, currently many of the solutions are falling short of absolute standards in data security and privacy. There are chances, although they do the basics, but the advanced features will be required as the solutions grow and have more features. We have to make sure that identity of the doctors and patients is validated. It is extremely important because the doctor could be getting a crank call from somebody claiming to be your patient. So that has to be protected. We have to make sure that it could be a quack posing as a doctor. So you need to make sure that the patient is not getting treated by somebody who's not a registered medical practitioner. So NDHM will bring out DigiDoc as the consolidated registry of all the doctors and healthcare providers. These are all steps in the right direction, and we need to move alongside these steps. It is also important that when the telemedicine solution is developed, we must make sure that there is an interface with standard drug databases. We noticed that a lot of solution providers have taken a few drugs that are given, they have noted down a formulary which is designed by the local doctors or by the hospitals. If we have to prevent medication errors, see, even in the physical context, when we are seeing the patient face to face, there is a lot of incidence of medication errors. When we are not seeing the patient and we are doing remote consultation, the onus of preventing medication errors is even higher, and it is always on the doctors. So therefore, it is necessary that we make sure that we know which are the drugs that we are allowed to prescribe through telemedicine, which are the medicines we are not allowed to prescribe, and what are the interactions, the drug-to-drug interactions with the drugs that we are about to prescribe or the drugs that the patient is already taking at home. There will be a lot of changes in the schedules that are being allowed to prescribe over teleconsultation, but we need to be always aware of what is relevant and what is current. From our side, in DH India website, we will always publish whatever are the updates. So for any of you who does not have the resources, you can always check with our website, and we will be publishing what is relevant in the digital health ecosystem in terms of the guidelines that are getting published or important papers, important announcements. We will do that. And for everybody, what I want to say is the opportunity is unlimited. Literally, the sky is the limit. In fact, it's, you have to go through, you can even go through the sky. The way I see, the way, the digital health opportunity is exploding in the country. It's a moment for all of you to be part of the $5 billion industry that is blooming ahead of us. So for all of you in the business of making telemedicine solutions, if we do it right, if we provide the right solutions, and if we meet the demands of the market, and if we keep the patient safety at the heart of whatever we are deciding, whatever we are designing, make sure that, because we are all here for the care of the patient, safe patient care should be the dictum behind anything that we design and that we provide to our customers. It should not be a fly-by-night operation. It should not be for a quick buck. It should be for something that is ethical, and it is taking care of the patient and ensuring that the doctor can provide his or her best through this solution that you have provided. So in future, device interfaces, integration with third party, teaming up with other solution providers is all going to be part of the game. It is no longer going to be all of us working in silos. We all have to become an interconnected community, and we need to look at how we will not actually get stuck in situations like COVID in the future. So this has opened our eyes. COVID actually has been a great eye-opener, as well as it has been a leveler. It has also been a disease that has taught us that we need to be all team players. So this is where the future lies, and we really wish to make sure that all the telemedicine solution providers that are there get the right market, and all the users that are there get the right applications, and the patient at the end is the one who benefits from it all.
Dr. Uma, if I may suggest, maybe know what is the status of the website right now, and supposing a person was visiting it, is it possible for them to see the registry right now? Can that be clarified?
So let me clarify what are the next steps. So by tomorrow, we will have the product summaries. We will start doing 10 at a time. So probably in a week's time, we will have the summary of all the products that have been evaluated. Tomorrow onwards, we will start seeing this. This report will be available on the website tomorrow. The evaluation standards and the maturity model that Ayushi described in detail, that alone requires a 1-hour session to share with everybody, and we will have one more session for about an hour to publish the details of the standards. If you have seen that model, there are certain asterisk marks there. Okay, so these are some of the features that we are getting validated by experts, and that is why all the products have not been completely evaluated, because there are certain features that we needed inputs from certain experts. So hopefully in another 7 days time, that exercise will be completed. Exactly a week from now, which is next Monday, you will be able to see summary of all the products and this detailed evaluation report. Once we publish the evaluation standards, hopefully in another 10 days time, we will assign the level to each product. We will assign the level based on the compliance standards, and we will assign a level for the most advanced feature that the solution has. Which means that this is because we found that some extremely good features which have been in the market for a long time, they have advanced features, but they fall short of meeting the telemedicine practice guidelines, and it is not because of any of their fault. It is because when COVID hit and telemedicine practice guidelines were announced, there was insufficient time for many of them to get their developers who were in containment zone, who were in lockdown, who could not work, or the solution providers themselves were so busy catering to the needs of COVID patients and triaging apps and meeting to the demands of the hospital that they had very little time to develop whatever development they had to do in their solution to comply with the telemedicine practice guidelines. So keeping that in mind, we have evaluated them at the telemedicine practice guidelines at one level, and there will also be an evaluation which is based on the advanced features that they do, and we will grade them according to that level. For the users, at each of the levels, we will also be telling as to which organization or which level of organization this level of product matches. So that is what will be available to you. Hopefully by next Monday, you will be able to see the complete registry, and we'll send information by mail to everybody who's a participant here and also to all the applicants. As we have mentioned and as we discussed, we found that there were certain deficiencies in certain products. Now, some extremely good products were also deficient in certain features. And whatever we found, sometimes we found it was because of the lack of understanding of the developer in the way they understood and the manner in which the healthcare ecosystem or the provider ecosystem works. And we can't blame them for it. So those inputs which are required for the functional inputs that are required for developing a good telemedicine solution requires discussion around these features. And we will conduct webinars around these features so that you hear it directly from the users as to what is it that they're looking for in a particular feature, so that the understanding of the user or the demand side of the market matches what you will supply to all these users. We are looking at a space where in future this dialogue between the user and the provider of the solution should be seamless, and we will try to create as many networks as possible, and we will start with teaching programs or the training program or webinars where people are free to attend that. And this will also include speakers from outside the country, speakers who are experts in these fields, so that we can discuss also on the futuristic trends. So, and we will be starting the evaluation of the special solutions, which are almost 93 odd tele-ICU, remote monitoring and all these solutions. We will be starting that from the next month onwards. The phase 2 of the telemedicine solutions, the virtual OPD solutions, the evaluation of the second phase of evaluation of those products will start from January, end of January or early February. One of the things that I want to clarify here for the people who have already undergone these evaluation, for the solutions that have been evaluated and who are in the registry, when they develop a new feature and they feel that their product needs to be upgraded in the levels, they can apply for an upgrade. Initially, for the next 1 year, we will have a 6-monthly upgrade. Thereafter, once things have leveled down and we probably do not want to have a 6-monthly upgrade, we'll probably have an annual upgrade. But that is clearly not something that we will decide now. We will decide based on the number of solutions that are applying to us for that registry. So this is the future plan. Pramod, is there anything else that we need to discuss?
There's a raised hand from Mr. Nandakumar, Dr. Uma. So
yes.
Maybe he wants to unmute and then ask his question.
So he can unmute himself, but before we unmute, I want to, okay, Dr. Nandakumar, please go ahead. Let's hear you out. You can unmute yourself.
He had raised his hand. I guess he's probably having some issues right now. Please carry on, madam, otherwise.
Okay, so is there any other question?
Well, the main question they were wanting to know was, I guess, when will the registry come up and when can they see these? Because right now they can see it under applicants, but when they go to the registry section, I guess they were wanting to know when they will start seeing these sort of classifications.
Because there are 48 people who have to just send us that one form, because we want to give them that benefit as well while we are publishing, and make sure that that when we are cross-checking with where we had doubts, we want to just make sure that that is corrected before we publish. For those people where we do not have any doubt, 10 at a time or 10 per day, we will start publishing, because we're just doing the grammatical checks and things like that.
Righto. Gaurav, you have raised your hand, Gaurav. Is there anything you wanted to ask?
No, sir, there's nothing I want to ask. It just happened due to some technical errors, and sorry for the interruption in between at the start.
Okay.
No problem, Gaurav. As I said, technology fails us when we need it most. So that is what happened. We face this every day, isn't it? So we have to make sure that we work very well with the IT people and that it doesn't fail like this. So is there anybody who has any questions or doubt? Pramod, do you see anybody raising hands?
Well, there are people raising their hands and I'm quickly trying to see. Alan, Mr. Alan, would you like to ask your question? And then, there's Mr. Edward. First, Mr. Alan, Mr. Edward. Can you unmute yourself and ask your question, please? Yeah.
Sir, this is Edward. Do we have still time to register our company? We are one of the solution providers.
Yes, you can. So you can register, Edward, because you can go to the site. Registry is open. You can register, and then we will send you information as to when we will be calling you for evaluation. The evaluation will not start before end of January.
Sure, ma'am. Thank you.
So you have time till then. I mean, you can apply anytime. That's not a problem.
Yeah, because when I was trying to register, I didn't see any link over there. I'll try once again. Thank you.
Okay, what we will do is, we had just sort of worked on the website, and maybe there is some glitch. We will check it, and can you check it tomorrow morning? We'll check it ourselves in the night.
Sure, thank you.
Mr. Edward, would you like to ask your question? Mr.
Yeah, I finished
Edward?
my question.
This was Edward.
Oh, that was Edward. Okay, sorry. Mr. Allen, would you like to ask your question?
Thank you. Yeah, my name's Alan Boyce. I'm calling from the UK, and Uma and I have compared
Hi,
notes.
hello. It's nice.
Hi.
Yeah.
First of all, congratulations. Incredible progress in difficult times. So well done. You can probably guess my question. I'm curious if there are other things you can apply from elsewhere in the world, because clearly everybody's facing the same challenge. Is there any observations or learnings that you've been able to build into your system from other countries?
So, Alan, primarily this product at this moment was designed India focused. All right, but it is not that we have not taken learnings from other places, because it has been a combined learning of all our alliance partners and members and the experts who have all had global experience. So we've brought that experience and are learning together on the same platform. But the registry primarily was focused for solutions that are being deployed in India and will be used in the Indian scenario. Now, I know where you're coming from, and definitely what we would like to do is, considering that this is something which is very useful across the globe, we would be more than happy to help and take your help and associate with you and work in the countries that we both are very fond of.
Perfect. Thank you very much.
Yes.
Right. Dr. Helima? Dr. Helima, can you unmute?
Hello, Dr. Uma. Good evening, ma'am.
Yeah, hi, good evening, Halima. Nice to see you again.
Nice. The entire presentation was excellent, and thank you for making up the whole registry. I just had a query that you told us that the detailed evaluation will be done in 10 days. But can we have a list of the products listed in the registry? I mean, just curious, that's it.
Oh, yes, we can.
Yeah.
I think if you visit the applicants tab in the website.
No, I did that, as you said. I visited the application
the registry
tab.
No. So what we will do is, we will put up the names of all the products that have completed their evaluation, and their product summaries are undergoing the grammatical correction. Okay,
Sure.
so that is the list that we will put out the list of those products over tonight.
Fine, waiting for it, ma'am. That's it. Thank you.
Check it tomorrow morning. Okay.
We will do that. Thank you so much.
All right.
Yes, thanks a lot, Dr. Helima. Dr. Subramaniam, would you like to unmute yourself and ask your question?
Yeah. Thank you, Dr. Uma. It was a good presentation despite few little technical glitches. Really enjoyed the presentation. As rightly said, the opportunities are unlimited, and I think the registry is really a right direction, a step in the right direction to get some sort of a standardization. So my question is not more question, more of a thought really. Is that it would be nice if the government of India, the digital takes initiative of some sort of a standardization whereby something like Aadhaar number, like in the UK where they have a national insurance number. So similar, something which can be facilitated so that the all the applications, like the platforms like one of us, we can be able to use it so that it will become a sort of a gold standard, so that the identity can be very well incorporated. So is there any plans or the registry can actually influence that direction? That was my question.
Yes. So that's a good question. But what we want to tell you is that as part of NDHM, which is being rolled out currently in some of the union territories, there is already a unique identifier for every citizen, which is voluntary based. Okay, so you are free to take a health ID. So that's a health ID that all citizens can take. So as and when the government rolls it out in respective states, it will be available, and it's a progressive movement. I mean that it's a progressive move. It'll go from the union territories and then to states. So that is one of the basic features in the NDHM. Part of, as I was saying earlier, part of the ultimate aim of NDHM is to empower every citizen with their health record in their own hand. And for that, the basic unit that is required is unit identifier. So every citizen will have that. And what we have to do in our solutions at this moment to see that we have
is that in addition to the
yes.
Aadhaar number? Sorry, would it be in addition to the Aadhaar number?
There was somebody speaking in between.
No, Dr. Subramaniam is asking, would it be tagged to the Aadhaar number? Right? That's the unique health ID. He's asking, is it in any way going to be tagged to the Aadhaar number? That's his question. And if I may reply, Dr. Subramaniam, so the option is there when you're applying for your unique health ID. They ask you whether you want to tag it to your Aadhaar. That option is given to you right now. The plan is in a year to a year and a half. In fact, it will be a mandatory thing that you will have to have one unique health ID that is tagged to your Aadhaar. Does that answer your question, Dr. Subramaniam?
Yeah, that's very good. Thank you for clarification. Thank you.
All right. Professor Moidu, sir, please.
Dr. Moidu, sir.
Hi,
good evening, Dr. Moidu. Thank you so much for attending. And I want to invite Dr. Moidu for the expert comments. And Dr. Moidu, can I introduce you in your own words? He is the oldest specialist in the youngest specialty. He is the senior most medical informatics specialist, probably globally, one of the senior most. At least in India, he's the senior most. And it is also my good fortune that we are from the same college and he's my senior and mentor. So for us and Digital Health India as well, Dr. Moidu is a mentor. Sir, can I have your comments, sir?
First, I wanted to stay under the radar today, but then I found it so open and so democratic that I thought, there was no need to put a hierarchy and you have let everybody share their thoughts. It's great because these things only grow with a democratic movement, not with centralized leadership. And I want to congratulate you for that. First, that's the structure. The second thing is the topic. The idea of a registry and the idea of a technology foundation where people can understand what has been achieved and what can be achieved begins with recording, documenting. And this effort of yours is amazing. It takes me back to my own history. Back in the 90s with WHO, after my doctorate, I worked very closely with the advisor informatics. And we had a center, what was called the Center for Health Application Software Evaluation. It was called CHASE. It was very interesting experience. Didn't take off much because the globe at that time didn't have money or the vision to adopt digital technology. So I think this is perfect and very timely. And I like the way you have limited your resources to India first. And it's a treat when you go to see informatics conferences that a large population is Indian. I don't know, maybe it's Indian languages that makes us so easily adaptable to computing. But whatever it is, no help desk is without an Indian. So I must congratulate you for doing this. And this is a very critical part of the help desk. I congratulate Pramod and you and all the other hardworking people who put their heads down and worked on this, that this forum, this step will really convert the people. And let's remember, I don't want an informatics person to be called an IT person. We are all healthcare workers. We do different things. Surgeons and physicians are also healthcare workers. So that'll be the one message I'd like to leave behind today, because yes, technology fails, so do surgeons fail, so do physicians fail. So after having been a doctor for 52 years, I can only tell you this. I've seen things stumble and move out, but this is a great effort, and God bless you all. Take it to the next level. Thank you.
Thank you very much, sir.
Thanks a lot, sir. Your
Mr.
blessings are indeed very important for us.
Mr. Rajiv Inamdar, you have a comment?
I'm Rajiv Inamdar. I'm a member of FICCI, Federation of Indian Chambers of Commerce and Industry.
Yes, sir.
I do not have any authority to give comments on the medical section, medical field as such, but I went through the document, and yes, I would like to take this ahead and offer my help to take this program through the Federation of Indian Chambers of Commerce and Industry. I myself am a project consultant, and I'm in the funding of several projects for social causes. So anything which I can do in the future, uh, the forum is most welcome for that.
Thank you, Mr. Rajiv. That's extremely kind of you, and we really welcome your suggestions and help. And we will definitely look at like-minded people to take this movement forward, because this is not just a project. This is a movement, and this is something that is really required to empower all of us at the grassroots level, because we want every citizen in India to understand how the digital health technology is going to change their lives. So thank you, Rajiv. Thank you very much.
Yeah, madam, I don't see any more raised hands, and I think now probably you want to sort of sum it up and ask our alliance
Just tell you
partners
what
also.
else. Yeah, so I just want to tell you what else Digital Health India will be doing in this telehealth ecosystem. So when we were evaluating these products, we realized that it is important. The solution providers who are doing telemedicine solutions are not able to find the right devices with which they have to interface. So now you see, we have to now create an evaluation and registry for the devices that can be used by the telemedicine solution providers to make their solution more powerful. So we are doing that, and as a prelude to that, we have a grand challenge and innovation awards for the devices that work in the remote diagnostic, remote monitoring, remote evaluation, and remote intervention. So this exercise is called Remedy Grand Challenge, and it is been announced, and it will be held. The award, judging and the award will be given sometime in late December, early January, and we will be then creating a registry for such devices. So that is the next project that we are doing in the telehealth ecosystem. Besides many other projects that you can see on our DH India website, the other projects that DH India is doing. We will be putting up all this in our website as well, and it's open to everybody who's in this ecosystem. So thank you all very much for participating. I want to thank all the applicants for giving us the opportunity to learn so much from what is happening in this space, which we did not know 5 months before. Having seen all the products and having seen the enthusiasm with which all of you have created such wonderful solutions, it is, I as a healthcare provider, and I feel very confident that there are a lot of people who are going to make lives easier for us. And thank you very much for taking all the trouble, for studying so much and innovating such good products and making it available for the public. So I hope that we will work together in future to ensure that we get really good products. I want to thank all the volunteers and everybody, all the alliance members, all the experts with whom we have taken advice on and off at all odd hours of the day and night. We have been bothering people. Thank you very much. So these are all the partners that we've had. We've had lots of interns from the Goa Institute of Management, from IIM, from EMPI Business School, and volunteers other than that. So thank you each and every one that has been associated with it. And I look forward to all such support in future, and we hope that we will have many more interactions. And I hope all the applicants will write to us and tell us what they have found incorrect in the evaluation that we've done, so that we can correct ourselves as we go forward. Thank you so much.